untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: can acid reflux cause throat issues? Answer by Rory Malone. The lay is a valve that opens to allow food and drink down to your stomach for digestion and closes to keep matter from reversing its flow back up. A weak lay isn't always able to close tightly. This allows stomach acids to creep back up your esophagus, ultimately damaging your throat and causing the familiar burning sensation. Video: Heartburn No More. TM. To manage a sore throat that accompanies acid reflux, it's more effective to treat the underlying cause. Garrett. Both over-the-counter, OTC, and prescription medications work by eliminating, reducing, or neutralizing stomach acids. The neutralizing process reduces heartburn and sore throat. Eat small and frequent meals and avoid acidic, spicy, or overly fatty foods. These items are more likely to induce symptoms such as heartburn and sore throat. Antacids are OTC medications. They work to neutralize stomach acid and relieve symptoms of GERD with salts and hydroxide or bicarbonate ions. Ingredients you should look for include: H2 blocker medications work by stopping cells in your stomach from producing so much acid. There are both OTC and prescription H2 blockers available. Some of the OTC options include: anywhere from 1.6 to 6.8% of adults in the United States develop Barrett's esophagus. People with Barrett's esophagus have a slightly increased risk of developing esophageal cancer. Answer by Chris Malin. Acid reflux causes what is known as heartburn. It is not usually described as a feeling of mucus. For hoarseness, there is just one thing to do: your vocal cords must be visualized. That brings us back to our old friend, the ENT surgeon. Numa's answer is correct, but long before you get to cancer, a particularly nasty form of cancer, esophageal cancer, you will have scarring in your esophagus. Many things are missing from your description. Do you smoke? How old are you? Do you abuse your vocal cords? Etc. Go see an ENT surgeon. Answer by Franklin Douglas. I am not your physician and this does not constitute specific medical advice. The symptoms you are describing are typical for LPR or laryngopharyngeal reflux. This has been treated with PPIs, proton pump inhibitors, like Nexium and Prilosec, but long-term use of the drugs may have unfavorable side effects. The first thing you should do is get the diagnosis confirmed by a board-certified otolaryngologist, ENT, who can use a TV camera to look at your voice box and confirm the diagnosis and make sure it is not something more serious. Next, you should talk with him about what the most effective therapy for you might be. In my patients, I have seen reflux controlled by addressing food allergies and using apple cider vinegar. Sometimes patients have an anatomical problem like a hiatal hernia or a weak esophageal sphincter and require surgical treatment. As always, it is best to avoid future problems with competent therapy before complications develop, including cancer.